While more and more new therapeutic agents are available to Taiwanese patients, could you share some of common regimens used in neoadjuvant therapy?
Yes. A combination of targeted therapy and chemotherapy is commonly used in neoadjuvant chemotherapy. For example, in HER2-positive breast cancer patients, we have lots of experience using trastuzumab plus pertuzumab as neoadjuvant therapy, which significantly increased the pathological complete response rate. And for triple-negative breast cancer patients, we know KEYNOTE-522 study recently demonstrated adding immune checkpoint inhibitor to systemic chemotherapy not only could increase pathologic response rate, but also extend survival rate.
Well, despite of all these novel combinations, is there still some limitations to current neoadjuvant therapy approach when treating early breast cancer, like according to your clinical experience? Could you share some of the limitations we face now?
This is an important question. Besides targeted therapy, anthracycline and taxane are still key components to neoadjuvant regimens for early breast cancer patients. These chemotherapy agents may induce acute and chronic toxicity, which leads to